Question 1. In light of recent developments in interventional cardiology, the use of fractional flow reserve (FR) and instantaneous wave-free ratio (IFR) has become increasingly important for assessing coronary artery disease. Mr. Anderson, a cardiologist, is preparing to perform a percutaneous coronary intervention (ECI), a patient with a suspected chronic total occlusion (CO). The patient's angiogram shows significant lesion in the left anterior descending LAD artery. Mr. Anderson is considering whether to use FAR or IFR to guide the decision-making process for revascularization. Which of the following statements is most accurate regarding the use of FFR and IFR in this scenario? A. FAR is more suitable for assessing coronary lesions in the setting of stable angina, while IFR is best used during acute myocardial infarction (AMI). B. IFR and FAR are both equally useful in assessing the severity of coronary stenosis, but IFR does not require the use of adenosine. C. FFR should be used in all cases of chronic total occlusions (CO) to guide treatment decisions as it is more accurate. Angiography alone. D. IFR is preferred over FAR in patients with high-risk coronary anatomy, such as those with bifurcation lesions, because it is more accurate in these cases. Answer. Correct answer. B. Explanation. IFR and FR are both used to assess the hemodynamic significance of coronary lesions, but there are important distinctions. IFR does not require the administration of adenosine, which is necessary for FFR measurements. FAR is typically performed in the context of stable coronary artery disease (CAT) to assess lesion severity and guide revascularization decisions. While both FAR and IFR can be useful in ETO cases, IFR is generally preferred for less invasive assessments since it does not require adenosine. In contrast, FAR has traditionally been used in stable angina, but is not necessarily more accurate than IFR in CRs. Therefore, B. Correct answer. Question 2. Considering the importance of proper equipment and maintenance in a cardiac catheterization laboratory cath lab, Dr. Martinez, a cardiac interventionalist, notices that the fluoroscopic equipment in her lab is not displaying the expected image clarity during a coronary angiogram. The images appear to be grainy and there is noticeable distortion. Which of the following is the most likely cause of this issue and what action should Dr. Martinez resolve it? A. The fluoroscopy tube may be malfunctioning. Dr. Martinez should immediately schedule a service technician to calibrate the tube. B. The image quality is likely due to improper contrast injection. Dr. Martinez should ensure that the contrast medium is injected more slowly. C. The issue may be related to inadequate radiation protection. Dr. Martinez should ensure that all shielding protocols are followed during the procedure. D. The equipment's digital processing system may need recalibration. Dr. Martinez should consult with the equipment provider for a system reset. Answer. Correct answer. D. Explanation. Grainy or distorted images during fluoroscopy are often due to issues with the digital processing system. These systems can become misaligned or require recalibration to optimize image quality. In contrast, malfunctioning fluoroscopy tubes generally result in a total loss of image quality rather than just graininess or distortion, while injection rate may affect the clarity of the contrast agent is unlikely to result in the kind of image distortion described here. Radiation protection protocols, while essential, are not typically a factor in image quality problems. Therefore, D is the correct answer. Question 3. During the process of coronary angiography, Dr. Johnson encounters a patient who is suspected of having severe aortic stenosis. The patient's clinical history includes heart failure symptoms, and the echocardiogram shows reduced aortic valve area. The patient has been scheduled for coronary angiography to assess potential coronary artery disease (CAD). In this case, what is the most critical factor for Dr. Johnson to consider before the procedure? A. Whether the patient is on anticoagulation therapy, as this may increase the risk of bleeding during the procedure. B. The patient's left ventricular ejection fraction (LVEF), as low LVEF increases the risk of procedural complications. C. The patient's renal function, as contrast-induced nephropathy is significant risk in patients with pre-existing renal disease. D. The need for intra-aortic balloon pump IAP support during the procedure, prevent hemodynamic instability. Answer. Correct answer. C. Explanation. In patients with suspected severe aortic stenosis, renal function should be carefully evaluated before coronary angiography. This is due to the potential for contrast-induced nephropathy, (CIN), which can be exacerbated by pre-existing renal dysfunction. Although anticoagulation therapy, low LVEF, and IAP support are important considerations, they do not present as immediate critical concerns as nephropathy in this scenario. Contrast agents used during coronary angiography can lead to CIN, particularly in patients with impaired renal function, and therefore renal function must be assessed prior to the procedure. Thus, C is the correct answer. Question 4. Dr. Evans is performing a left heart catheterization and is planning to measure left ventricular LV pressures. He is concerned about potential complications arising from incorrect placement of the catheter. The patient has a history of prior mitral valve surgery, which complicates the anatomy. What is the most important factor to ensure accurate LV pressure measurement during this procedure? A. Ensuring the catheter tip is placed in the aortic root to measure pressures accurately. B. Confirming the catheter is positioned at the level of the left atrium to prevent false readings. C. Carefully guiding the catheter past the mitral valve to avoid damaging the valve or creating further mitral regurgitation. D. Positioning the catheter at the midventricular level for accurate pressure readings in the left ventricle. Answer. Correct answer. C. Explanation. Accurate left ventricular pressure measurement requires careful placement of the catheter tip within the left ventricle, ideally avoiding the mitral valve to prevent damage or disruption of mitral regurgitation. Ensuring the catheter does not pass through the valve or exacerbate regurgitation is particularly important in patients with a history of mitral valve surgery, while placement in the aortic root or left atrium appropriate for other measurements. The most critical consideration in this scenario is preventing further complications from the mitral valve. Therefore, C is the correct answer. Question 5. In response to an emergency situation, a patient undergoing an EI experiences severe hypotension. The patient's blood pressure drops significantly during stent deployment, and the clinical team is concerned about the possibility of shock. Dr. Green, the interventionalist, recognizes the need to stabilize the patient before proceeding. Which of the following is the most appropriate pharmacological intervention for managing this situation? A. Administering intravenous nitroglycerin to reduce preload and relieve myocardial ischemia. B. Administering intravenous dopamine to increase cardiac output and improve tissue perfusion. C. Administering intravenous heparin to prevent thromboembolism. D. Administering intravenous morphine to manage pain and decrease sympathetic response. Answer. Correct answer. B. Explanation. In the context of severe hypotension during PCI, intravenous dopamine is commonly used as a first-line pharmacological intervention. Dopamine helps increase cardiac output and improve tissue perfusion, which is critical in stabilizing the patient during shock. Nitroglycerin, while useful in relieving myocardial ischemia, may further reduce preload and exacerbate hypotension. Heparin is used to prevent thromboembolism but does not directly address hypotension. Morphine can help with pain management but does not play a primary role in managing shock during PCI. Therefore, B is the correct answer. Question 6. When analyzing the consequences of inadequate radiation protection in the cardiac catheterization lab, Dr. Simmons is reviewing the protocols for minimizing radiation exposure during procedures. The lab is equipped with high-tech fluoroscopic systems, but Dr. Simmons is concerned about the potential long-term risks of radiation exposure to the staff. What is the most effective strategy for minimizing radiation exposure to both the patient and the staff during the coronary angiography? A. Ensuring that staff wear lead aprons and thyroid shields at all times during procedures. B. Using the lowest possible fluoroscopy settings and limiting exposure time during the procedure. C. Reducing the number of radiographic images taken during the procedure to minimize cumulative radiation dose. D. Only performing fluoroscopy when absolutely necessary and using other imaging modalities when possible. Answer. Correct answer. B. Explanation. Minimizing radiation exposure is critical in both protecting the patient and the staff during interventional procedures. The most effective strategy involves using the lowest possible fluoroscopy settings, limiting exposure time, and ensuring that procedures are performed as efficiently as possible. While lead aprons and thyroid shields provide essential protection, radiation dose reduction is primarily achieved. Careful optimization of fluoroscopy settings and time. Reducing radiographic images. C. And limiting fluoroscopy usage. D. are also important but may not always be practical in complex cases requiring thorough assessment. Therefore, B is the correct answer. Question 7. Mr. Thompson, a patient undergoing PCI, is experiencing significant chest pain despite receiving adequate sedation. He is conscious and alert, and his vital signs indicate stable but slightly elevated blood pressure. Dr. White, the interventional cardiologist, is considering the need for adjunctive pain management. Which of the following is the most appropriate next step for managing Mr. Thompson's pain during the procedure? A. Administering nitroglycerin to relieve chest pain and reduce myocardial oxygen demand. B. Increasing the dose of sedatives to further relax the patient and alleviate discomfort. C. Administering a small dose of morphine to relieve pain and reduce sympathetic response. D. Using local anesthetic around the coronary vessels to numb the area of intervention. Answer. Correct answer, C. Explanation. Morphine is an effective agent for managing pain and also reduces sympathetic response, which can help alleviate myocardial oxygen demand and reduce stress during PCI. Nitroglycerin A may help with ischemic chest pain, but is not the best agent for acute pain relief. Increasing sedatives B may not be appropriate in this case, especially considering the patient's stable vital signs. Local anesthetics D are not commonly used for pain relief during PCI, as they may not provide sufficient pain control for the entire procedure. Therefore, C is the correct answer. Question 8. Dr. Patel is performing a coronary angioplasty in a patient with a bifurcation lesion. The lesion involves the main branch and a side branch, which complicates the stent deployment. Dr. Patel is concerned about the potential for stent malposition or dissection during the procedure. What is the most effective strategy for managing this bifurcation lesion during PCI? A. Deploying a single stent in the main branch and performing balloon angioplasty in the side branch. B. Using a two-stent technique, such as the provisional or cullot technique, to treat both branches simultaneously. C. Avoiding stent deployment in the side branch and treating it with medical therapy only. D. Using a drug-coated balloon. D to B. To treat both the main and side branches without stent placement. Answer. Correct answer, B. Explanation. For bifurcation lesions, the use of a two-stent technique, such as the provisional or cullot technique, is considered the most effective strategy. This approach ensures that both the main branch and side branch are adequately treated, with careful attention to stent positioning and optimization. A single stent may be insufficient for adequately treating both branches, and avoiding stent placement in the side branch C is ideal for complex bifurcation lesions. Using AED may be appropriate in some cases, but stenting remains the standard treatment. Therefore, B is the correct answer. Question 9. Mr. Garcia, a 65-year-old patient with a history of hypertension and smoking, is undergoing a coronary angiogram to evaluate suspected coronary artery disease. The angiogram reveals significant stenosis in the right coronary artery, or CA, and Dr. Lee is considering percutaneous coronary intervention (ECI). What is the most important factor for Dr. Lee to consider when deciding whether to proceed with PCI for Garcia? The patient's overall risk profile, including comorbidities and current symptoms. B. The severity of the stenosis in the CA. PCI is typically indicated for lesions greater than 70%. C. The patient's age and frailty, as older patients are less likely to benefit from PCI. D. The availability of specialized PCI equipment, as certain lesions may require advanced devices like rotablators. Answer. Correct answer, A. Explanation. When considering PCI, the patient's overall risk profile, including comorbidities like hypertension, smoking, and symptoms of angina, is the most critical factor. PCI is generally indicated for significant stenosis, but the decision should also consider other factors such as the patient's functional status and symptom severity, while the severity of stenosis, B, and the availability of special equipment, D, are important. They are secondary to the patient's overall clinical picture. Age and frailty, C, are also important but do not outweigh the need to address symptoms and functional impairment. Therefore, A is the correct answer. Question 10. In response to an emergency situation during EI, Mr. Adams experiences an abrupt decrease in coronary flow after stent deployment. The interventional team is concerned about a possible stent thrombosis, What is the most appropriate pharmacological intervention to prevent stent thrombosis in this situation? A. Administering aspirin to inhibit platelet aggregation and prevent thrombosis. B. Administering clopidogrel to prevent platelet activation at the stent site. C. Administering heparin to prevent further thrombus formation. D. Administering both aspirin and clopidogrel as dual antiplatelet therapy DAPT. Answer. Correct answer D. Explanation. Dual antiplatelet therapy (DAP) with aspirin and clopidogrel is the most effective pharmacological intervention for preventing stent thrombosis after PCI. Aspirin inhibits platelet aggregation, while clopidogrel prevents platelet activation at the stent site. Heparin C is often used during PCI to prevent thrombosis, but is not sufficient as a long-term solution for stent thrombosis prevention. Therefore, D is the correct answer. Question 11. In the context of performing a cardiac catheterization, a 68-year-old male patient with a history of diabetes and hypertension is undergoing coronary angiography. During the procedure, the team notices a significant stenosis in the left anterior descending artery. The patient's blood pressure drops to 80/50 mmHg and his heart rate is 45 beats per minute. What is the most appropriate first action to take in this situation? A. Administer atropine to increase the heart rate. B. Administer a vasopressor to elevate the blood pressure. C. Administer a dose of nitroglycerin to relieve vasospasm. D. Perform immediate chest compressions. Answer. Correct answer A. Administer atropine to increase the heart rate. Explanation. The patient's symptoms are suggestive of bradycardia, which is likely causing the hypotension. Atropine is the drug of choice for treating symptomatic bradycardia in this scenario, as it can increase the heart rate and improve cardiac output. A vasopressor, option B, might be required later if the blood pressure remains low, but the first action is to address the bradycardia. Nitroglycerin, option C, could worsen hypotension in this context, and chest compressions, option D, are only necessary if the patient goes into cardiac arrest. Question 12. Given the circumstances, a patient is undergoing ECI, percutaneous coronary intervention with balloon angioplasty. During the procedure, the interventional cardiologist notices an angiographic sign of an intravascular thrombus. Which of the following is the most appropriate pharmacological intervention for thrombus management during PCI? A. Heparin infusion to prevent further thrombus formation. B. Direct thrombin inhibitor infusion. E. G. Bivalirudin. C. A fibrinolytic agent. E. G. Alteplase to dissolve the thrombus. D. Aspirin to inhibit platelet aggregation. Answer. Correct answer B. Direct thrombin inhibitor infusion. E. G. Bivalirudin. Explanation. The use of bivalirudin, a direct thrombin inhibitor, is highly effective in preventing thrombus formation during PCI and reducing complications. Heparin, option A, is commonly used, but bivalirudin provides more effective anticoagulation in cases where thrombosis is detected. Fibrinolytics, option C, are generally not used PCI because they can cause bleeding complications. Aspirin, option D, helps prevent platelet aggregation but is not sufficient for managing an intravascular thrombus. Question 13. During a procedure in the cardiac catheterization lab, a patient presents with severe right lower leg pain, coolness, and decreased pulses after femoral artery access. The interventional team suspects a vascular complication. Which of the following is the first step in managing this complication? A. Administer anticoagulants to prevent clot formation. B. Apply a compressive dressing to the femoral access site. C. Perform a Doppler ultrasound to assess for arterial occlusion. D. Immediate surgical intervention to repair the femoral artery. Answer. Correct answer C. Perform a Doppler ultrasound to assess for arterial occlusion. Explanation. The first step is to perform a Doppler ultrasound to assess blood flow and determine whether the cause of the symptoms is arterial occlusion, hematoma, or another vascular issue. Depending on the findings, further intervention may be necessary. Applying a compressive dressing, option B, might exacerbate the problem if there's a clot or occlusion. Anticoagulants, option A, may be necessary but should be guided by diagnostic findings. Immediate surgery, option D, is only required if there's evidence of significant arterial damage or dissection. Question 14. To better understand the impact of radiation exposure in A cardiac catheterization lab. The radiation safety officer in the lab is assessing the potential for radiation-related injuries to staff. Which of the following strategies is the most effective in minimizing radiation exposure to staff during interventional procedures? A. Use of lead aprons only as they are the most effective protective measure. B. Use of a radiation shielding device such as a lead glass barrier combined with minimizing the use of fluoroscopy. C. Minimizing the duration of the procedure and increasing the distance between staff and the fluoroscopy equipment. D. Limiting the number of staff members in the room and reducing their exposure time. Answer. Correct answer. B. Use of a radiation shielding device such as a lead glass barrier combined with minimizing the use of fluoroscopy. Explanation. Radiation safety is best achieved by combining multiple strategies. Using a lead glass barrier and minimizing fluoroscopy time is essential for reducing radiation exposure. Lead aprons, option A, alone are not sufficient to protect staff from scattered radiation. Increasing the distance, option from the radiation source, is a good practice but is less effective than physical barriers. Reducing staff exposure, option D, is a valid approach, but using protective devices is a more direct and effective method of ensuring safety. Question 15. During a cardiac catheterization procedure, a patient is found to have a coronary artery dissection after stent placement. The interventional cardiologist considers the use of an intra-aortic balloon pump IAP for support. Which of the following physiological mechanisms is the IAP designed to address in this context? A. It increases myocardial oxygen consumption to improve contractility. B. It enhances coronary perfusion by inflating during diastole and deflating during systole. C. It reduces the workload on the left ventricle by increasing systemic vascular resistance. D. It improves venous return to the heart, reducing preload. Answer. Correct answer. B. It enhances coronary perfusion by inflating during diastole and deflating during systole. Explanation. The IAP works by inflating during diastole to increase coronary blood flow and deflating during systole to reduce afterload. This improves myocardial oxygen supply while simultaneously reducing the workload on the left ventricle. It does not increase myocardial oxygen consumption, option A, nor does it systemic vascular resistance, option C. It also does not directly affect venous return, option D. Question 16. Based on the information gathered, a 55-year-old woman undergoes a coronary angiogram revealing a chronic total occlusion (CEO) in the right coronary artery. The physician decides to attempt a EER. Which of the following is the most common complication associated with ETCR? A. Vessel perforation due to aggressive catheter manipulation. B. Contrast-induced nephropathy from the contrast media used. C. Acute dissection of the coronary artery during wire insertion. D. Acute thrombosis after stent deployment. Answer. Correct answer A. Vessel perforation due to aggressive catheter manipulation. Explanation. Vessel perforation is a well-recognized complication in CECI due to the complex and often challenging nature of the procedure of aggressive catheter manipulation and wire techniques can cause perforation. Contrast-induced nephropathy, option B, is a concern, but is less frequent in this context. Acute dissection, option C, is a potential complication, not the most common one in CECI. Acute thrombosis, option D, could occur, but is not typically associated with EEC. Question 17. In light of recent developments in the management of peripheral vascular disease, a patient is undergoing a procedure for angioplasty of the femoral artery. The operator is concerned about potential complications related to access site bleeding. What is the most effective measure to prevent bleeding complications after sheath removal? A. Compression of the femoral artery at the site of insertion for 1520 minutes. B. Administration of protamine sulfate to reverse anticoagulation effects. C. Use of a vascular closure device to achieve hemostasis. D. Immediate reinsertion of the sheath for further hemostasis control. Answer. Correct answer. C. Use of a vascular closure device to achieve hemostasis. Explanation. Vascular closure devices are specifically designed to seal the access site and prevent bleeding complications after sheath removal. Compression, option A, may be effective but is not as reliable as closure devices. Protamine sulfate, option B, is used to reverse heparin but does not directly address bleeding at the access site. Reinserting the sheath, option, is not typically necessary unless there is significant bleeding or a vascular injury. Question 18. Upon closer examination of a patient's coronary angiogram, a complex lesion is identified in the left main coronary artery. The cardiologist decides to proceed with percutaneous coronary intervention (ECI). Which of the following factors should be prioritized when deciding whether to perform PCI or consider coronary artery bypass grafting (CAG? A. The patient's preference regarding the type of procedure. B. The severity and location of the coronary lesion as well as the overall coronary anatomy. C. The cost of the procedure including both PCI and CAG. D. The length of time the patient has had the lesion. Answer. Correct answer. B. The severity and location of the coronary lesion as well as the overall coronary anatomy. Explanation. When deciding between PCI and CAG, the severity and location of the lesion are critical factors. A complex lesion such as in the left main coronary artery may be better treated with CAG if it poses a significant risk of complications. Patient preference, option A, is important but not the primary consideration. Cost, option C, and lesion duration, option D, are secondary to the clinical factors in this decision-making process. Question 19. Considering the evidence from recent studies, a patient undergoing coronary artery bypass surgery is found to have moderate stenosis in the left circumflex artery. The surgeon decides to conduct an angioplasty procedure in conjunction with the bypass. Which of the following is the most appropriate approach to treating this additional lesion during the surgery? A. Perform the angioplasty first to assess the lesion before bypass grafting. B. Perform the angioplasty after the bypass grafting to avoid hemodynamic instability. C. Perform a stent deployment immediately after angioplasty to ensure long-term patency. D. No angioplasty is needed. Proceed directly with bypass surgery. Answer. Correct answer A. Perform the angioplasty first to assess the lesion before bypass grafting. Explanation. In hybrid procedures, angioplasty is typically performed first to assess the stenosis and determine if the lesion can be treated successfully with PCI. By performing the angioplasty first, the surgical team can decide whether bypass grafting is necessary. Stent deployment, option C, is often used but is not always necessary in all cases. Moderate stenosis. Bypass surgery, option D, may be avoided if ECI is successful. Question 20. While evaluating the performance of cardiac catheterization procedures, the physician notices that the X-ray images are consistently showing poor contrast and resolution. Which of the following is most likely the cause of this image quality issue? A. The fluoroscopy system settings are improperly adjusted. B. The contrast media volume used is too low for adequate imaging. C. The patient is experiencing tachycardia, leading to poor image quality. D. The catheter placement is incorrect, leading to poor imaging. Answer. Correct answer. B. The contrast media volume used is too low for adequate imaging. Explanation. Insufficient contrast media, option B, can cause poor image quality during angiography by failing to highlight the vascular structures clearly. Fluoroscopy system settings, option A, should be checked, but contrast media volume is a common cause. Tachycardia, option C, can reduce the clarity of images but does not typically result in contrast. Incorrect catheter placement, option D, would cause imaging difficulties, but this issue is less likely than inadequate contrast. Question 21. A 62-year-old male patient with a history of coronary artery disease presents for a coronary angiogram. During the procedure, severe stenosis is found in the right coronary artery, RCA. The cardiologist decides to perform balloon angioplasty. Which of the following is the primary goal of balloon angioplasty in this patient? A. To remove the plaque and restore normal vessel size. B. To reduce the risk of vessel rupture during the procedure. C. To restore adequate blood flow to the myocardium. D. To prevent the need for coronary artery bypass grafting. Answer. Correct answer. C. To restore adequate blood flow to the myocardium. Explanation. The primary goal of balloon angioplasty is to restore adequate blood flow to the myocardium by dilating the stenosed vessel. While balloon angioplasty can lead to some plaque disruption, its main purpose is improving blood flow. vessel rupture risk option B, and preventing CAG option D are secondary considerations. Removing plaque option A is not achieved by balloon angioplasty alone. Stenting is often required for that purpose. Question 22. A 45-year-old female patient with diabetes mellitus undergoes a percutaneous coronary intervention (ECI) for a stenosis in the left anterior descending LAD artery. Following the procedure, she develops a non-segment elevation myocardial infarction and STEMI. Which of the following is the most appropriate next step in management? A. Administer fibrinolytics to dissolve the clot. B. Start a heparin infusion to prevent further thrombus formation. C. Perform a repeat angiography to assess for stent thrombosis. D. Increase the dose of aspirin to improve platelet inhibition. Answer. Correct answer. C. Perform a repeat angiography to assess for stent thrombosis. Explanation. A repeat angiography is necessary to assess for stent thrombosis, which is a potential cause of the end STEMI after PCI. Fibrinolytics option A are generally avoided in the setting of ECI, as they may increase the risk of bleeding. Heparin option B is already likely being used and would be adjusted if necessary, but stent thrombosis is the prime concern. Increasing aspirin option D may not provide additional benefit. Question 23. During a cardiac catheterization, a patient presents with severe bradycardia and hypotension. The team suspects that the bradycardia is related to vagal stimulation during the procedure. Which of the following is the most appropriate immediate intervention? A. Administer atropine to block vagal effects. B. Perform chest compressions to increase cardiac output. C. Administer adenosine to correct the bradycardia. D. Administer intravenous fluids to correct the hypotension. Answer. Correct answer. A. Administer atropine to block vagal effects. Explanation. Atropine is the drug of choice for treating bradycardia caused by vagal stimulation during procedures like cardiac catheterization. Chest compressions, option B, are unnecessary unless the patient becomes pulseless. Adenosine, option C, is used for certain arrhythmias but not for vagally-mediated bradycardia. Intravenous fluids, option D, may be used if hypotension persists, but the immediate concern is addressing the bradycardia. Question 24. A patient undergoing coronary angiography is found to have a left main coronary artery LAA lesion with significant stenosis. The cardiologist is considering whether to perform percutaneous coronary intervention (ECI) or coronary artery bypass grafting (CAG). Which of the following factors is most important in making this decision? A. The patient's preference for a less invasive procedure. B. The complexity and location of the lesion in the coronary anatomy. C. The patient's insurance coverage and financial considerations. D. The experience level of the cardiologist performing the procedure. Answer. Correct answer. B. The complexity and location of the lesion in the coronary anatomy. Explanation. The complexity and location of the lesion, especially in critical areas like the left main coronary artery, are the most important factors in determining whether PCI or CAG is the preferred treatment. While patient preference option A is important, it is secondary to the clinical factors. Insurance option C and the cardiologist's experience option D are not typically the deciding factors in this case. Question 25. 55-year-old male patient with a history of hypertension and hyperlipidemia is undergoing coronary angiography. The procedure reveals a chronic total occlusion (CEO) in the right coronary artery, or CA. What is the most appropriate management strategy for this patient? A. Perform balloon angioplasty and stent placement to open the RCA. B. Recommend coronary artery bypass grafting (CAG) to bypass the occlusion. C. Administer fibrinolytics to dissolve the clot and restore blood flow. D. Continue medical management with antiplatelet therapy and statins. Answer. Correct answer. B. Recommend coronary artery bypass grafting (CAM) to bypass the occlusion. Explanation. In cases of chronic total occlusion (CO), especially in critical coronary vessels like the RCA, CAG is often preferred to ensure adequate myocardial perfusion. Balloon angioplasty and stent placement option A can sometimes be attempted but are less likely to be successful in E. Fibrinolytics option C are generally not used for CTOS, and medical management option D may not be sufficient in this case. Question 26. A 72-year-old male patient with a history of coronary artery disease and prior PCI presents for elective coronary angiography. During the procedure, a significant stenosis is noted in the left anterior descending LAD artery. Which of the following is the most appropriate next step in the management of this patient? A. Perform balloon angioplasty and stent placement. B. Start the patient on intravenous nitroglycerin for vasodilation. C. Administer intravenous morphine for pain management. D. Perform coronary artery bypass grafting. Answer. Correct answer A. Perform balloon angioplasty and stent placement. Explanation. In patients with significant stenosis in a coronary artery PCI with balloon angioplasty and stent placement is the preferred treatment to restore blood flow. Nitroglycerin, option B, may be used for relief but is not a definitive treatment for stenosis. Morphine, option C, is used for pain control but does not address the underlying cause. Option D may be considered if the lesion is complex or ECI is not feasible, but angioplasty and stent placement are typically the first-line treatments. Question 27. A 60-year-old patient undergoes a cardiac catheterization with the insertion of a femoral sheath. After the procedure, the patient experiences significant swelling and bruising at the femoral access site. The most likely cause of this complication is A. Hematoma formation due to inadequate hemostasis at the access site. B. Infection at the catheter insertion site. C. Arterial dissection during catheter insertion. D. Venous thrombosis at the femoral vein. Answer. Correct answer A. Hematoma formation due to inadequate hemostasis at the access site. Explanation. Hematoma formation is a common complication after femoral artery access, especially if proper hemostasis is not achieved after sheath removal. Infection, option B, is less common but can occur. Arterial dissection, option C, is a more serious complication but would typically present with more severe symptoms. Venous thrombosis, option D, less likely to cause significant swelling at the femoral access site. Question 20. A 50-year-old woman with a history of hypertension presents for a coronary angiogram. The angiogram reveals a 90% stenosis in the right coronary artery. The cardiologist decides to perform balloon angioplasty. Which of the following is the most significant risk of this procedure? A. Coronary artery rupture leading to cardiac tamponade. B. Development of restenosis due to inadequate stent placement. C. Thromboembolism leading to a stroke. D. Contrast-induced nephropathy due to the use of contrast agents. Answer. Correct answer A. Coronary artery rupture leading to cardiac tamponade. Explanation. While balloon angioplasty is generally safe, one of the most significant risks is coronary artery rupture, which can lead to cardiac tamponade and life-threatening hemorrhage. Restenosis, option B, can occur but is usually managed with stent placement. Thromboembolism, option C, is a risk but not as significant as artery rupture. Contrast and nephropathy, option D, is a concern but is not the primary risk in this case. Question 29. A 68-year-old male with a history of diabetes mellitus and hypertension is undergoing coronary angiography. The procedure reveals a severe stenosis in the left circumflex artery. The cardiologist decides to perform percutaneous coronary intervention (ECI). Which of the following is the most appropriate antiplatelet therapy to administer prior to the procedure? A. Aspirin alone to prevent platelet aggregation. B. Clopidogrel alone to inhibit platelet aggregation. C. A combination of aspirin and clopidogrel for dual antiplatelet therapy. D. Ticagrelor alone to inhibit platelet aggregation. Answer. Correct answer C. A combination of aspirin and clopidogrel for dual antiplatelet therapy. Explanation. Dual antiplatelet therapy DAPT with aspirin and clopidogrel is the standard approach to prevent thrombotic complications during and after PCI. Aspirin alone, option A, is not sufficient in this setting. Ticagrelor, option D, is an option but typically used in combination with aspirin for high-risk cases. Question 30. A 75-year-old female patient with a history of coronary artery disease presents for elective PCI, a significant lesion in the left anterior descending artery. Which of the following is the most important factor to consider in deciding whether to prefer PCI or coronary artery bypass graft in CABG? A. The patient's age and life expectancy. B. The severity and location of the coronary lesion. C. The patient's ability to tolerate the procedure. D. The patient's social support and lifestyle factors. Answer. Correct answer. B. The severity and location of the coronary lesion. Explanation. The severity and location of the coronary lesion are the most important factors in determining whether PCI or CABG is the appropriate intervention. Age and life expectancy, option A, are important considerations but are secondary to the lesion characteristics. The ability to tolerate the procedure, option C, is always considered, but the clinical decision is primarily based on lesion severity. Social support, option D, is relevant but does not directly influence the decision between PCI and CABG.